All right, so welcome to the Deloitte HealthConnect webcast. My name is Vicky Levy. I lead our life sciences and healthcare practice here in Europe and Switzerland. Today, we're digging into a topic that is near and dear to my heart, as I, like all of you are, I'm also a patient. So we're really excited to get together within this forum again and exchange views on what patient equality and health really means. And we're going to exchange that with an exciting group of panelists, including hearing from two thought-leading and what I would call activist patients, but more on that in a moment. We're hosting this special webcast series together with the Healthcare Businesswomen's Association and Singularity University. For years, we've been talking about patient centricity, but the patient is rarely, genuinely, truly at the center. What if we talked instead about making patients equal partners in healthcare, from research and development through healthcare delivery? What if we empowered patients by giving them control over their data, embracing digital medicine, personalizing their treatment? Imagine, companies will describe themselves as patient-centric, given that they're making and marketing products for patients, many developing services for patients and truly wanting to help patients. There's no doubt that this industry is focused on care for patients. But do they really treat patients as equal? If we peel it back, the patient perspective has traditionally been approached through the lens of the other, how physicians look at patients, how the regulator looks at patients, how the payer looks at patients. It's always through another lens. So what we wanted to do in this discussion was to spend the next hour challenging ourselves to really examine the concept of patient equality. Let's try it on. The conversation could get uncomfortable if we were sort of provoking. Are we really ready for it? Do we see examples that we could already reward, fuel, put energy behind? And then I think we'll explore a bit of how the technological advances companies are adapting and we're all wearing and adapting through all aspects of our lives. Will those digital technologies really help accelerate that path towards patient equality? Technological advances are fueling real breakthroughs, whether in terms of data gathering, so not just patient-reported outcomes, a concept those of us focused in the industry are well aware of, but patient-generated outcomes, or in helping patients to manage their conditions or treatments through the behavioral change stimulated and supported through the digital technology that we wear and around us. But these advances also pose some pretty significant questions. Which technologies are most impactful? Can the companies experiment with all of them? How do you make choices? What do you do with the wealth of data that is being collected? How do you manage it? Who owns it? Who's going to control how it can be used? Should it be controlled? Is that patient equality to have someone else determine who controls how your data is used? Should patients determine that? How does the industry create the right level of trust with patients as we explore this concept of patient equality? We want to ensure this is a dialogue and that you're part of the conversation. Please feel free to be into the conversation, entering comments in the chat box at any time during the webcast to ask your questions, to add your comments. We'll be monitoring them and making sure we address them either throughout the conversation or at the end of our discussion. With that, Gemma?
Thank you, Vicky. Warm welcome from my side. My name is Gemma Mazaks, and I have the honor today not only to co-moderate this session, but also represent the Healthcare Business Association, or HBA, with more than 40 years of legacy, more than 10,000 members around the globe, and generous sponsors like Deloitte. We joined forces to ensure gender parity. A bit about myself: I'm a passionate finance working in the healthcare industry for more than 14 years. I would like to give the word, so for a quick round introduction to our panelists today. Annemiek.
Thank you very much, Gemma. My name is Annemiek Fram. I'm a medical sociologist and I'm the founding director of ICON. ICON is a patient-led consultancy agency, and our goal is to achieve equal collaborations of patients in the healthcare sector. We do this by conducting action research, by developing programs, and most of all, our main focus at this moment is we are developing a do-it-yourself co-creation tool because we want as much people as possible in healthcare being able to perform co-creation with patients at an organizational level themselves.
Dana, thank you very much.
Hi, everyone. I'm Dana Lewis. I am a patient who's been living with type 1 diabetes for over 18 years now and celiac disease for about 12 years now. And the difference between being diagnosed with diabetes at age 14 and then celiac disease during college and the emergence of social media influenced me wanting to work in healthcare in the communication space, and especially with social media and digital media, to figure out how do we help all of healthcare help engage patients and help patients access information and support and care. So that's kind of been the theme of my professional role. But in the last couple of years, I started self-innovating in the diabetes space because there was a lack of commercial innovation and tools available to me. So a lot of my perspective comes from not only working professionally in healthcare in the past, but then also trying to bridge the gaps that I saw in healthcare as a patient.
Thank you. Lucian.
Well, thank you very much, first of all, and thank you also for these rock stars that just are in front of me, figuring out indeed also how this patient equality aspect that should be on top of our minds really fits in. My name is Lucian Engelen. I'm one of the Edge Fellows for the Center for the Edge at Deloitte for 3 days a week. Edge Fellows are not employed by Deloitte, but we also help advising Deloitte and their clients in making those big challenges and also shifts possible. Also connected as faculty to Singularity University, Silicon Valley, try to picture also these exponential growth aspects where technology really could help, specifically on the aspect of patient empowerment in the broader sense of that. And with that, back to you, Gemma.
So, Yusuf.
Hello, everyone. Good afternoon. My name is Yusuf Aladami. I'm a technology partner with Deloitte. I spent the last 10 years working primarily in life science organizations, mostly based in Europe. I live and work in Switzerland. And, I tend to work with large organizations on their technology capabilities and strategies. And I think today, what I'm going to try and do is give a little bit of a perspective on how large enterprises are addressing the notion of patient centricity and patient equality. So looking forward to the conversation.
Thank you.
Excellent. With that, before we on what patient equality means to you, 1 or 2 words, and you're going to see a Mentee survey now, obviously on the webcast now. You can use your phone and just QR code it quickly. There may be also directions in the chat, which I can't see, but I think the QR code should help. And we'll just give it a couple minutes. And please just put in a word or 2. I'm going to do the same. That's my way of testing that the technology really works.
We're doing all the same. Oh, look at that.
But just because you have your phone out, now we have the discipline of putting our phone down. Already I saw a distracting text from my daughter. There we go. It's interesting to see some of the words coming up here. I'll give it just a few more minutes. Mm-hmm. Certainly, or seconds, I should say, certainly the question of personalization, there are many themes here around medicine, drugs fit for purpose, appropriate therapy. For me, that's the clinical side of patient equality.
And
But I really like some of the more emotional words as well. Empathetic, a dream. I call them emotional words. It's my judgment. Empowering, autonomy, shared, equality, of course. Keep adding. And as we're going through this, just in the spirit of giving someone a heads up, Annemiek, as we go through this, it would be great to hear your reactions to this and start with you. What does patient equality mean for you? And then as we get into it, do you see a gap from where we are today to patient equality?
Thank you very much. I love to see all these words. For me, patient centricity, like shared decision making, it's also part of patient centricity. It's really the patient is in the middle of care, and we organize everything around the patient. It's for me, in my video, introduction video, I was talking about the patient being invited at a party, and patient equality is about being asked to dance. And I think it's a more active way of approaching each other, not only at the individual level of healthcare, but when we talk about patients' equality, it's also about co-creation care together. And it's about, like, I've been born with osteogenesis imperfecta. It's also called the brittle bone disease. And all my experience from my life, I would love to collaborate with innovators, drug developers, scientists in making healthcare as good as possible, making it fit as much patients as possible. And in co-creating together, there's a lot of energy, there's a lot of inspiration, and there's a lot of opportunities, also in cost efficiency. And I think it's patient equality is about listening to each other, not only the patient talking and the patient in the lead, but also listening to an innovator, listening to a nurse, listening to a doctor, and together thinking what is possible and how can we make the next step in healthcare, how can we make healthcare fit patients, and how can we improve lives of patients, not only patients being happy, but also patients being able to make use of their healthy part of their life. Yes.
Annemiek, thank you. Maybe I start with the more pokey or provocative question. How close to that very, for me, that's inspirational. How close are we to what you just described?
I think
and feel free to be blunt, please.
Yeah, I think we are aware of that this is necessary, but we really need to make the next step in doing it. Like really co-creating, really starting small. You don't have to do big programs and strategies, but start small. Start next month with a nice listening session or a dialogue with patients, and then decide what you can do next.
Dana, I would love to hear your perspective. Same question to you. What is patient equality, being careful with my language, really mean for you? And how far are we from that in your own sort of personal experience?
I think we're pretty far away. I was really struck in reacting to seeing the word empowering up there. That word to me is kind of a double-edged sword when we talk about patients, because oftentimes when we talk about somebody being empowered, it implies we're giving them power that they didn't have before. And the gap is that they should have had that power all along. And so the healthcare system and the way people access care and the way care is funded, I think, it doesn't have the patient as the equal partner all along. And so for me, there's a huge gap, and we've got to completely rethink all of these components to get there. And so that's kind of why I feel we're so far away. And I really struggle with that. And I just think about, there's so many dynamics where the patient isn't equal to the point where, they're begging the healthcare system to take care of them. They are begging to be treated as an individual. So patient equality is also not just about treating every patient alike or rebalancing the power, but making sure every patient is treated the way they need to be treated. And I think about that as a person with diabetes, where I have type 1 diabetes. Millions of people have type 1 diabetes. Millions of people have type 2 diabetes, but they're very different diseases. And even my experience with my type 1 is very different than the next person with type 1. And so my needs and the way I need to be treated are very, very different. But oftentimes, just the power structures are such that patients are lumped all together and treated equally, and equality can also be a negative thing. So I think that's a double-edged sword too. So in short, I think there's a huge gap. I think we have a long ways to go. And I really want to think about, okay, if we stop thinking about patients as an add-on to the system we have, but really start thinking about redesigning the system of what it would take with patients equally partnering in that redesign, I think we're going to get closer than really the incremental step add-on approach that's not putting patients where they need to be.
Thank you for the perspective. So many comments you made there. It's so tempting to dig into the concept of empowerment, follow the money. I want to come back to some of the things you said, certainly in our conversation. But as we're starting into this, what do others think bring to life? What does patient equality mean to you?
Exactly. Lucian?
So Vicky, I can give you, my perspective. I think, if I was starting with maybe a vision statement, I would say, it's about patients being, far more educated than they are today about, health in general, and then obviously their own disease conditions, etc. And I suppose a little bit to Dana's point, far more confident to get into an active conversation, be an active participant in their own journey, to challenge, to push back, to ask for other options. And I think, maybe I'm a little bit more of an optimist. I see that there's a lot more of that. I mean, there's more and more research that suggests that people are more comfortable to challenge, and they're more educated from the ability to go and look things up. So there's some positives in there. I guess maybe one of the angles that we're going to discuss today is how technology can be a force to enable that sort of a vision. And I think, I think if I were being Panglossian, I think it can. I think there's a lot of opportunity, as we've seen in other industries and other facets of life, for technology to act as a leveler, something that creates a better, bi-directional engagement, a little bit the way Dana discussed. And I think there's an opportunity for technology to create a level of control around data, which is the key to the future of health, that is at the individual and the patient level. I'm also a little bit of a skeptic. I think the history of the last 20 years also suggests that without a lot of regulation and without thinking through the playing field, there's a lot of room for very winner-takes-all types of models to pop up. So I think as we have the discussion today, I'd probably see it from both those angles. I think there's a lot of great opportunity to kind of run towards that vision, but there's a lot of risk as well.
Well, and building on that, I think one of the things that we see, it also depends on the lens that you take. And one of the lenses that I always like to look into are these patient journeys, as we often mention that. And when I was doodling a couple of years ago a slide for one of my presentations, I was picturing the patient journey that we often use in healthcare, which are merely not more than a journey of a patient in a institution, actually. And the majority of those cases, it is not even a journey in the whole institution. It's only one for one physician or one professor or what have you. And when I was doodling this little picture, Annemiek actually came into my office on an iPad on wheels, and she shook her head back in those days. And I clearly remember that. I said, "You just don't get it, is it?" I said, "So what am I missing out?" And she said, "It's the journey of life, dummy. That is the thing that really matters to me." And from that perspective and from that lens, if you start looking into everything that we do, already using technology for that, for instance, you clearly see a totally different perspective in that, which in my perspective really does make sense. And from the moment and time when we really take that into account, that's where and I'm trying to be gentle here, Vicky, in terms of being blunt as well. I don't think that we even scratch the surface on this. In many, many cases, it still is tokenism, like it was in the early days of the Wild West movies, where a director would say, "Go get an Indian," because it is a Western after all. And that same thing happens over and over again, still to patients. If we don't really start to collaborate in co-creation with everything that's needed right from the get-go. It's merely nothing more than tokenism. Back to you.
Thank you very much for sharing your perspective. And perhaps based on that, Annemiek, could you tell us, what do you see is holding us back to treat patients as equal partners?
Well, I think like health professionals are sometimes scared for the expertise of patients. I think they are, it's a little bit threatening to feel the expertise and to listen to the expertise of patients. For myself, it's kind of a delicate question to hand over scientific information to my own doctor. And why can't I tell him what I found on the internet? There's a very strange dynamic in choosing what kind of expertise is real, and how can I conversate with my doctor about the things I can find on the internet. I'm the expert of my life, and I think I can agree he's the expert or she's the expert on very special medical issues, and I want to have an equal conversation. But they still not dare to listen to my opinion, and this is on an individual level. And I think it's the same problem on a co-creation level in innovation or in scientific research or in drug development. People are kind of scared for the stories of patients. And I think we should be a lot braver, patients, in telling what they discover, in telling what they need, and doctors, co-creators, innovators in daring to listen to the stories of patients.
Indeed, thank you very much. And based on what you said, I mean, we have here in our panel, Dana Lewis, you develop your own pancreas. So can you tell us more about how was that when you were talking to the doctors?
So for context, I was diagnosed with type 1 diabetes at the age of 14. And so I had a pretty typical patient experience for the first 10 years of that, where I would go into the endocrinologist, get a prescription for insulin. Eventually I got an insulin pump and a CGM. But when I realized that those tools were they were better, but they still had problems, the doctor's like, well, it is what it is. We can't change that. That's the company's job. And so I would talk to the companies and ask for improvements or changes and explain why, and I was told that I'm the only one with this problem, or they were working on it and it would be out in the next version in a few years. And, that is just increasingly frustrated, because you're like, I did everything I was supposed to do as an empowered patient. Like, I did my things and I'm still not seeing change, and it's still not being, quick enough to solve my problem. So I began to do it myself. And, it was really, that's when I feel like I was doing everything right before. But if you have to say, when did you become empowered? It's when I realized that I could start solving my own problems outside of the healthcare system. That technology was to the point where patients have all of these amazing knowledge sharing resources, but technological resources, including the phones in our pockets and existing medical devices and existing computing devices, to build our own solutions. And it's not about creating a company and, taking over the world or taking over healthcare, but it's really about, I wanted to solve my problem. And then I wanted to help others, and others wanted to solve their problems. And that became just so powerful and really shifted my perspective on, that's why I think there's such a gap in the equality in healthcare, is because oftentimes we add on patients too late in the process to try to change healthcare, to try to change design. And whether it's research, whether it's design of a medical device, or whether it's redesigning the actual process of delivering and providing care to patients on acute or chronic situations, we have to have patients being involved first, because to Annemiek's point, it's our life. We're the experts. It's always really challenging for me as a patient when I go into a doctor, whether it's a doctor that I've had and I have a relationship with, or an acute situation, like I have to go to urgent care because I'm sick, or when I fell off a mountain and broke my ankle and I was being helicoptered over to the hospital in New Zealand. And I was terrified, not only because I didn't know if I broke my ankle and what was going to happen, but I was also trying to think of how to position myself to show them that I was informed and empowered and was managing my diabetes, and what I needed them to manage was my broken ankle. But oftentimes when you're labeled as a person with diabetes, you are treated as a subpar patient, as like, you don't know how to manage your diabetes. If you have to interact with the healthcare system, you've done something wrong. You get your power removed, your agency removed to take care of yourself, even if that's not why you're there. So whether it's a routine sickness, an acute fracture, or, something else totally unrelated, it's just really interesting to me how much, that label of being a patient sometimes is helpful, but sometimes I have to do a lot of work to manage that relationship to try to get equal care to other patients. And it's mind-boggling that that's the way it is, but you have to do a lot of work, a lot of invisible labor, a lot of emotional labor to manage that relationship or that situation and decide how much information do you tell them that you learned on the internet or from the research papers that you read yourself or that you've learned from your own, N of one or community research. It's hard. And not every patient is going to have that experience. Not, every person is going to have that level of interactivity or knowledge or want to take that much action, but there's a spectrum. And so we need to rethink how we have healthcare allow for that spectrum of experiences and that spectrum of knowledge for patients.
Thank you, Dana. Yeah, indeed. And to that, perhaps linking to, and perhaps I would like to ask this question to Lucian, based on empowering the patient, Lucian, what's it for the industry? What are the advantages?
Wow. What's needed if you want to create a new product? You need to have the knowledge about the product that you want to create in terms of technology, like an engineer, or in terms of the financials, like in the business modeling needed for that. And then if you do that for healthcare, you obviously need professionals like physicians or researchers, or hopefully also nurses. What's needed for that? What would be the reason not to incorporate the expert in having that disease or that specific condition? I actually cannot imagine, and still are kind of baffled that ever since that I stumbled across that perspective, which was, by the way, in Dubai in 2011 or something like that, where I was invited for a speech at a conference about mHealth, mobile health, and they talked about a $1.7 trillion market next year that was going to occur. And when I was on stage scheduled, I asked whether or not that there was a physician in the audience or patients, and there were none. There was a dentist from India that literally was in the wrong conference, and I still cherish his business card for that was willing to listen to me. And that's where I at least decided to no longer speak at conferences where patients were not involved in the programming and in the content of that. And the same goes also for industry. And I understand clearly that there's tons of regulations in not being able to go to conferences, but as long as legislation is blocking patients to attend a conference in life science and only to visit one specific marked area of that conference and not to speak to industry or professionals, we're still doing a lousy job. So what's in it for the industry? Making sure that you create a solution that really is, one, needed, that really, two, helps in terms of having the right perspective as opposed to only a segment of a patient journey, and three, to really have an impact in the lives of patients and people and their family and in formal care. So I could not imagine to do it differently, and I hope, to Yusuf's point, technology is going to bring us opportunities and tools to help with that. And that's where I'm excited about this current day and age, where we really can start to do that, and actually also on a global scale. Let's be honest, I've got different nationalities in this call. I was in Italy this morning, and I will be in Canada later on. It gives us the opportunity to collect knowledge from across the globe. And also with this digitization, it's making the world a lot smaller, Gemma.
And I think just to add on real quickly,
I want to add a comment
about the I think in terms of industry, especially in diabetes, we have seen it prove out over and over again with different solutions that patients and the community has created, that there is a huge need, and we are proving the need. We're doing the market research for the company and saying there is demand and people are willing to pay. They are begging and trying to throw money at the companies. And so in terms of what is the opportunity for industry, the opportunity to make buckets of money by making these small changes or doing these small innovations that all it takes is involving patients, like Lucian said, but otherwise that money is just being thrown away.
Completely. I appreciate the passion, and I fully agree, obviously, with both of you. Let's go there in this transition, right? That is kind of the hope, right? I think we buy the hypothesis that the hope is that the ubiquity, the availability, the lower cost of technology enables us to get closer to this. But let's start first from Annemiek, from your perspective as a patient. You're much more than that. But as we think about patient equality, can you bring to life very personally how technology has enabled you to take more control over your healthcare, or perhaps, you know, to the phrase du jour, to help you approach your care as an equal?
Yes, I would like to show you some numbers. Perhaps we can start a slide. This is the time I've spent in my life living with osteogenesis imperfecta. I've experienced more than 70 fractures of my bones. And as you can see, it's about meeting doctors, emergency rooms, cast makers, paramedics, social security officers. It's a lot of time spending in healthcare. And can you imagine when I fracture a bone on a holiday in the north of the Netherlands, it's still not possible to share my x-rays from my region, from my hospital in my own region. Really, this is for other sectors, this is 1995 and we're living in 2020. But what really takes a lot of time, I will show in the next slide, and energy in my daily life is the hours spent in waiting rooms at the hospital. It's about all the hours spent in making phone calls with hospitals, with healthcare organizations. Is the administration that's still on paper, and the huge amount of care given by my parents, by my brothers and sister, and by my partner. And now you can stop the slides. In COVID-19 times, we experience what is possible. We experience things that were never possible, like I can have a video consultation with my doctor. I can email my GP. I can even talk with the healthcare officer of my social services by WhatsApp video conference calling. I can rehabilitate online, and I can consume a lot of healthcare at home. And I'm so happy about that. There's still a lot of work needs to be done. And I'm sure we could have reduced the list you saw with 50% if it was possible for me to use all existing healthcare innovations in my life. And I think we should really take the next step and implement technology and innovations in patients' lives and not only talk about it.
Annemiek, thank you. And thank you for bringing it to life. I guess just a personal question. Throughout this time then, you showed the data, you showed where you spend your time, and you showed and you shared what's changed during COVID. Did you feel more equal in these interactions? Did the feeling follow? Were you treated differently as a result of the data you were able to bring into these discussions?
Partly, I felt more equal when being able to write an email or to ask a little question. Normally, I'm thinking, is this question important enough to make an appointment with my doctor? And now I think, well, it's a small question. I can send an email, and that feels more equal. But on the other hand, when I want a video consultation with a doctor, I still hear some people telling me, well, that's a lot of work and I need to open all that screens, and I prefer a telephone conversation. And then in the telephone conversation, it's really like a business talk, like these are your lab results and these are the chains of medication. And it's not about my life. When I see somebody in the face, like this wonderful conversation we are having right now, I see all the things happening in your face, and I feel more open and free to talk about my life. And I think it's very important to, not as a doctor, I think this same doctor is a surgeon, he's able to operate by a robot, he's very technical, and still he's not able to talk with me via video conferencing in opening two screens. I can't understand. So I think
at least we got telefaxes, Annemiek.
And facilitate hospitals. They are working on computers with Windows 95. We really should make a next step and facilitate also some basis equipment in hospitals to make this possible.
I love the challenge. Thank you. And thank you for bringing it to life. Yusuf, you look at those data, you have here a very informed, as you said in your intro, informed patient, a patient empowered with data, knows how she spends her time, knows what the full journey of life is. How are the gears shifting for you as you think about how are life sciences companies trying to meet patients like Annemiek where they are? How can they adapt the technologies to really accelerate equality? Are they even doing that?
Yeah, I mean, so I suppose I think the larger life science organizations that I would work with, that a company like ours would work with, I think they're very focused on how can they, put patients at the center, how can they increase their level of engagement with patients. I think that's a little different from the equality discussion we're having today, but it's in that direction. And I think they're all taking, certainly the ones that I see, they take it very seriously, but it's a heavy lift. I mean, I think in the last, if I think about the last 5 years, there's been, a huge amount of energy and investment and focus on probably the first wave of those kind of digital engagement concepts. And you mentioned, Lucia mentioned one earlier, but I mean, I think, the digital provisioning of better information at more tailored points in patient journeys, adherence applications, patient enrollment applications. I think there's been a lot of kind of early improvement, but nothing in the direction that I think Annemiek was talking about. I think there is now, maybe in the second wave of this kind of focus on patient centricity, there is more investment in trends like, importing some of the capabilities that you would more normally see in a consumer setting. So to your point exactly, Annemiek, taking things like marketing concepts and applying them to patients. Marketing technologies particularly can be used and repurposed, if you like, to create a more personalized and multi-channel experience in the direction that you talked about. So I think a lot of large life sciences organizations are making investments in those kind of platforms and capabilities, and I think as those mature, they will enable a better tailoring of interaction engagement through a patient's journey, but also the integration into things like, Annemiek, your example of, why can't I have an easier sort of telemedical interaction, or why can't I use a wearable device to capture some information and put it somewhere else? So I think, Vicky, to your question, I'm making a lot of big investments in those kind of capabilities. I mean, I think those things will take time to mature. I mean, if you think about how those waves impacted the consumer world, it took 10, 15 years. And I think it's in some ways more complicated in a life sciences context because of the differences in geography and different disease states and so on and so forth. But I think those things are happening. I think maybe one last point on that is, I think going back to one of the points that was made earlier, those are really different capabilities. It's a different way of thinking for a lot of these organizations. So alongside these focus on the technology itself, I think there's more and more, and we see this actually in a lot of my clients, there are a lot more hiring of people with different mindsets. And Dana, to your example, design skills, design thinking skills, customer research type capabilities. And these are relatively new disciplines, I think, for some of these very large organizations, which have been, they've been very successful in their current model for a long time. So Vicky, I don't know if that answers the question.
Yeah, no, it does. It does. I mean, this has been an ongoing conversation. We've had this Deloitte HealthConnect discussion, and we've had a number of the privilege of a number of opportunities to speak with Dana and hear her perspective. And as one of the themes that is coming up again is the mindset shift that's needed is radical. However, Annemiek and Dana have both said, but the behaviors and the things that companies can do can be small. Take the small steps, remove little frictions, removing little friction on top of little friction on top of little friction creates actually quite a big impact. So we don't need to solve all singing, all dancing. Can there be one entire master data system that everybody that has perfection in it? So again, that theme is popping up of the mindset shift needs to radically shift, but the behaviors and the actions can be incremental. I wanted to pivot slightly because in order to do all of this, and we saw it with Annemiek sharing her personal data quite literally with us right now, which gets me into what are some of these debates, right? From Lucien, from your perspective, as more and more data comes getting generated by the patients and used with the healthcare systems, and maybe nurtured and integrated with other players in this industry. How do we build the trust? How do we make sure the data are used for good? What's the right stance from your perspective on how data are being generated and how data are being protected?
Well, let me first build briefly on what just Yusuf said. I think one of the things is also how we structured this, the industry. We're talking about life science and health, and sometimes life science and healthcare. Those are two different worlds. The world of healthcare delivery, totally different of the life science in terms of the technological and everything that goes with it. And so also from the perspective of trust and the use of technology, to me, it's not about who owns that data. It's more like who has access to that data. And from that access to data, I actually think, and I've made that statement a couple of times, and it won't change if I would repeat it, but I actually think that having access to all your own data, not as a patient, but as a citizen, should be a constitutional right. Now it's been put in all kinds of silos, and some companies even think that it's their intellectual property. And I would say you're able and allowed to use it for the things that I grant you access. And we're now going into a new era where data is going to be ubiquitous, and it's going to be collected always in every place with all the technology that we have. And that also brings in the healthcare sector, I think, a paradigm shift also in terms of who owns the data, from hospitals, for instance, opening up their medical records in a portal to their patient, like Dana said, almost like allowing you to access your data. And now we're getting into this era where I think patients and citizens are going to allow you as a professional a subscription on my data. And that is what I like to refer to like the Copernican moment, where from in the mid-1500s, Copernicus proved that the sun was not circling the earth, but the other way around. And now still is the patient circling the professional. And with all this new development, I think it's going to flip, where sometimes the professional, maybe in real time or virtual or sometimes physical, is going to circle and visit the patient. That is what was healthcare hundreds of years ago, where the physician would visit you in the comfort of your own home, and every technology that they had would fit into the doctor's bag. And I think with all the shrinking of technology and also the things that Yusuf touched upon, we're going past that moment back again. And with all the DVDs and the tail effects still needed to have healthcare operationalized, that is going to shift. And I think the healthcare, so the life science industry, is going to take a very big stance in that if they would like to incorporate in collaboration, in co-creation, actually what's needed for the patient, the family, and informal care.
And can I add 2 points to that? I think, Lucien, I agree with you. We would absolutely need to flip and do data for the patient first. But I think it's going to be hard if we look at the history of diabetes and data. In the 70s, fingerstick blood glucose testing was created, and doctors fought against patients doing this at home because they might do something with the data. And then in the early 2000s, when continuous glucose monitoring came out, they fought patients having the data on their device because they might do something with the data. And now today, the regulatory bodies have requested that the manufacturers put a 3-hour delay on your data going into HealthKit or other secondary displays because, wait for it, patients might do something with their data. So this perspective is just mind-boggling different. I agree with you. Like, we need to get there. We have to have the flip, but I'm scared that it's going to be so hard to actually make the flip because of what 50 years of diabetes data has shown us, that both the healthcare providers, the regulators, everybody is just so concerned about protecting the patient that they're harming them by withholding the data and the access to the data. And I think that balance of the risk and the benefit has to be part of the conversation. And that's just not happening in healthcare today.
You know, Dana, totally true. But maybe Dana and also Annemiek, I think and I sense that things are shifting in that perspective. I think the discussions that we need to get these things up and running are shrinking. We can convince, so to speak, or also use legislation and also demand from the patients themselves that it's kind of speeding up. Is that also your sensing in that as well?
Yeah, I mean, the hashtag that our community uses is hashtag we are not waiting. You're not going to do it. We're going to do it. We're going to show the demand, and we're going to keep doing it and wait for you to catch up, but also push you to move faster. So we are seeing that happening. We've made progress in diabetes, but now we have to do it everywhere else, right? So we have to have this pressure from professionals like y'all, as well as, patients from all of these disease areas pushing together to make it happen.
And I think it's also in education, like when doctors, the paradigm shifts in doctors because the education shifts, we will get another culture. And I think this culture shift is really needed to get equal collaboration with patients and all loved ones too. Yes.
Mm-hmm.
And I think that's the perfect segue to ask the audience for the questions. But before that, because I have so many questions, I would like to ask you. We have in our audience people from the industry, and hopefully they will be. Will be also very glad to hear you. Is there the one thing that you see as a quick win? If you could think of one. At this moment, that could make a big impact, removing the frictions that Vicky was mentioning. So, Dana?
I think the quickest win would be having a conversation with patients and seeing what they perceive the barriers to be. Because I think what industry perceives to be the barriers are not the same thing as patients and barriers. And I think industry will be able to very quickly address some of the barriers that patients see more quickly than their own.
I was a manager for a project named Science for Patients, and we asked patients, what questions do you have for scientists? And the scientists were so inspired by this question that they changed their total science programs for the next 4 years. So I think it's so easy to start a dialogue and to ask people, what is your story? And what do you think we should start with?
I see one of the questions of Annick de Vocht in terms of how could we combine different data pools into one. That's exactly what I would love to show. This is happening as we speak. This is an announcement from Apple, just to name one, where they, together with the NHS Oxford University, created a system where all the electronic medical records of the patient are pushed into the Apple's Health app on the phone of the patient themselves. And with that, and that is what I think is very important, combining the electronic medical records of the hospitals, combined with the data of clinics, combined with the data of the patients that they're collecting themselves. And now, for the first time ever, and you can argue whether or not Apple should do that, or Microsoft or Google, I don't care at this very moment for that. For the first time, also the patient is able to combine that data and give that back to the professional, whether that be a physician, be a researcher, or a nurse, for instance. So I think that is the way forward, and that's also exactly what Dana says. Wait for it. I would change the hashtag, Dana. Wait for it. We're coming for you.
Yeah, actually, it's quite an interesting perspective when you put something like that up, Lucian. We see so many examples, and then I think, so then what does the, I guess Yusuf, bring to life for us? So what does the pharmaceutical company or the manufacturer, the medical technology company, how can they best fit in, shape, accelerate, given the players are already moving in this direction? That was not a manufacturer, that was Apple, and that was the NHS.
Yeah, no, it's a good question. I mean, so I suppose I would answer it partly also merging with the previous question around quick wins. So I mean, I'm not sure that there are quick wins that are going to get you towards that vision that are necessarily within our control. There are probably quick wins that aren't in our control, and I guess COVID is a great example of an accelerator. It's much discussed. I won't repeat the point, but I think we're doing things now that would have taken a long time to do without Corona, and specifically on the example of something like Apple or the technology platforms acting as a kind of unifying force. The example of the Google Apple tie-up, the sort of not-for-profit tie-up around tracking, is a great, in a way, analog for what we're talking about around the 360 idea. It's two organizations that are not known by patients or consumers to be in within the healthcare or life sciences ecosystem. They don't have the trust issue. They may have other types of trust issue, but they don't have the trust issue of the farmers. And by collaborating, they have an incredible reach and penetration across everyone's devices because of the two key operating systems that are out there. So I thought that was your example, Lucian, is interesting because you only have to extend it one step and multiply it by COVID to see that there are some emerging analogs. But I think, Vicky, back to your question. I think for life sciences companies, it's quite a confusing question because I think they have to hedge their bets in a way. They have to try and invest in their own capabilities and their own ways of capturing and storing data related to their patients and so on and so forth. But they also have to provision for the potential and the likelihood that other players will come into the ecosystem. And I think that's what we see that they are doing. They are kind of maybe not consciously hedging bets, but making investments in capabilities that build up their own kind of critical competencies. And then also integrating, building alliances with, technology and academic institutions and patient advocacy groups to try and, make sure that however that kind of future of health plays out, they are a part of it. And I think that's, in a way, the only strategy because it's a complicated situation.
Thank you. And I mean, we're getting quite some good questions here. I'm also thinking through the sort of breadth versus depth question. So Annemiek, give us a teaser. There's a question here. You talked about your co-creation tool. Certainly, I'm sure your individuals can follow up, but give us a little bit of a teaser of what's behind that tool as it could be useful for others operating in this case, someone operating with the NHS.
The tool is all about methods, how you can cooperate with patients. You can filter on in what states of innovation you are and what kind of methods fits that phase of innovation. And you will learn about a value-driven approach in co-creation with patients, because co-creation is not only about putting a patient on the table, but how can you interact with a patient so you really make the most of this conversation? How can you arrange a safe environment in which everybody will tell what is really needed? And learning this value-driven approach, it's all in the tool. We will launch the Dutch version at the end of this year and the international version in the beginning of next year. So please contact me if you are interested. And we are, of course, already willing to help before we are launching the tool.
Terrific. Thank you, Annemiek. A couple quick ones, and then we'll flip to some closing thoughts. Another quick one. We've talked about COVID. Of course, it's what we're all living, and we can't have you all together, hence the experience we have right now. But with regard to this specific question, Dana, or this specific time in the question that we see here, Dana, can you talk, are you optimistic or pessimistic? Where do you fall? Are the changes that we're seeing here, are we turning back, or have we turned a corner with regard to what this has accelerated, just from your own perspective in your own diabetes care?
I think COVID, as much as I hate it and it terrifies me, it's actually been a really good thing for people with diabetes and healthcare. If you take away the risk of actual COVID, so much care has turned into virtual care. We realized how much you don't need to physically interact. People are more empowered to use the data that we have on our devices instead of just throwing the data away or disregarding it. I think it's really positive. But what I hope in general from COVID that we learned, if you look at the people who jumped in early on January, February and started solving problems and using technology to really quickly accelerate and apply what we know about technology outside of healthcare into healthcare. And because COVID is such a big scare for all of us and we don't know what to do, I feel like healthcare was more receptive to outside technologies. So the good example is the exposure notification technology. There were dozens of different groups that started, including us, of building open source exposure notification technology to be able to track symptoms or track confirmed COVID cases. And healthcare was really, really receptive to that. So I think COVID has been definitely an accelerating force in healthcare to better adapt technology that has existed for years, where we're now realizing, thanks to the threat of COVID, that we can more directly apply it to healthcare. So I think that's a positive thing. I just hope that the openness of healthcare of embracing this technology applies beyond, this first couple waves of the crisis. But we've got to take that energy of adopting technology more quickly and keep that, stuck in healthcare really good into the future. So I'm optimistic on that part.
I love the optimism, and thank you. And I agree. So I have a closing question for all of you, and then I will wrap. Which is a question from the panelists. Thank you, Phil. So I guess the question is a more fundamental question, which from your perspective, what is the value proposition of patients accessing and leveraging their data in very sort of tangible ways? Bring that to life, no particular order, whoever wants to jump in.
I'll go first. We as patients, because we have access to our data in diabetes and we've innovated tools on that, have made fundamental scientific discoveries about type 1 diabetes that the scientific and medical communities have not been able to do. So the fundamental value right there is we are able to expand knowledge way more quickly in new areas that would not be possible for decades without patients digging into their data. So for me, that's the value, that's the power, is expanding scientific knowledge, expanding the care we can provide to patients. That would not happen without this access to data.
Yeah, I think I could give maybe a personal perspective. I think I've had a personal challenge with both. I have two kids. Both of them have relatively mild but chronic conditions that took really a long time to figure out what they were. And actually, it took a huge amount of energy and challenge and argumentation by my wife and I, particularly my wife, to be honest, to obtain the right information and make sure it was available to the next people we would go and see. And I think we went through about 10 different healthcare settings, healthcare professionals before we got to something that we feel is a good pathway for the future. And I think the thing that enabled that was that we knew that control over information and data at each step was going to be key. And I think that's partly because we have some understanding of why that's important. I think that's not necessarily ubiquitous at the population level. So I think the value proposition is going back to the beginning of this conversation. It's what empowers and enables patients to go and have more involvement in their own destiny.
For me, it's all about I've got a rare disease, and there are only 1,000 people in the Netherlands with this disease, but there's only one person with a special mutation, and that's me. And I want to find my copy in the world, so I can change experiences and to find out what kind of possibilities there are. So I think data will help people with a rare disease sharing and getting opportunities for scientific research, because there are no opportunities when the numbers are so low.
Well, let me answer that with a kind of a curveball, Vicky. I think that the analogy here is that a lot of people talk about artificial intelligence, AI, in healthcare that for whatever reason could kind of make physicians obsolete. And we all know, of course, that that's not going to be the case because of the doubling on healthcare demand. Physicians who will not use AI, those will become obsolete. And the same is true with this value proposition in this. If you don't accept that this is a collaborative aspect where the data should be a two-way street to enrich it in combination with everything that's been said, you will be out of business at one point in time, or you will become disrupted. So it's either sitting at the table and creating that in co-creation, the new models in a new experience model for it, or might as well try to do something else. And maybe you can sell tailor fax machines or whatever, because for whatever reason, they do not become obsolete up until now.
I fully agree. I mean, this could tell a little bit too much about me, but the more data I have, the more I'm an equal. And that has to be the assumption from my perspective. Hey, listen, I have really appreciated the conversation. There were some topics that were brought up earlier that I wish we had time to delve into even more deeply. But as always, we've run out of our time. So a couple of things. We're going to continue the conversation on patient equality because it's just that important. Today, we focused mostly on patient equality in care delivery. And I think Annemiek and Dana, you really brought to life what that has meant to you in very tangible ways. We're going to continue the discussion. Next week, we're going to take patient equality into the drug development process. How are the advances in personalized medicine, precision treatments, which came up in our the word cloud that you helped us generate? How will those advances help us begin to treat patients more equally in the development of the medicines themselves? And you can see here the panelists, we're going to have a combination. We're going to take some things, continue perspectives and kind of bring them forward. We bring some new people in. That's the way we want to keep running the Deloitte HealthConnect, continuation of perspectives, introducing new perspectives, and continue to challenge ourselves and not just have generic discussions, but hopefully more provocative ones on topics I know we all care about. So with that, in the registration in the chat, we would love your feedback. If you want to find out more about any of these panelists, get in touch with the panelists. We can do that. You'll find the ability to give us in the chat itself. And please do continue to join us next week. We'll take this conversation into the development arena and really look at patient equality from that perspective. With that, I bid you good afternoon, good evening, good morning, wherever you're joining us from. Thank you for spending the hour with us on this topic, and we will be in touch again soon. Thank you.